Hello everyone, today's question is going to be dealing with eating disorders. Let's get started. A 22-year-old female presents with persistent fatigue and irregular menstrual periods. Several times a week, the patient has episodes or where she uncontrollably consumes large amounts of junk food. She feels disgusted with herself afterward and subsequently does additional exercise. Exam shows pharyngeal erythema and parotid enlargement bilaterally. Potassium level is low and amylase is high. BMI is normal. Which of the following medications would be most effective in treating this patient? Now, this patient has signs of bulimia nervosa, and we know this because she has episodes of eating large amounts of food, and afterwards, she has a subsequent behavior to reduce weight gain. So, this is going to be differentiating bulimia nervosa from a binge eating disorder. With a binge eating disorder, we're going to have the patient eat large amounts of food, but the patient is not going to have a compensatory behavior afterwards to reduce weight gain. Now, the exam shows pharyngeal erythema and parotid enlargement bilaterally. Why does that happen? Well, we're going to be, well, patients with bulimia nervosa commonly induce vomiting to reduce weight gain. So, if we're vomiting, the acid from the vomit can damage the lining of the esophagus as well as the throat, resulting in pharyngeal erythema. And it can also damage the salivary glands, resulting in parotid enlargement bilaterally. And remember, the vomit is also going to contain potassium, so we're also going to be getting rid of potassium in the vomit, giving us low potassium levels. And the amylase is high because when we're consuming large amounts of food at once, in order to digest that food, the body is going to produce high levels of amylase. So as a result, these are going to be some common signs of bulimia nervosa. Now the BMI is 20. As a result, this is a normal BMI, so we can't diagnose the patient with anorexia. Remember, in order to diagnose someone with anorexia, the BMI has to be less than 18.5. The answer to this question is going to be answer choice C, which is fluoxetine, which is an SSRI that we can use to treat patients with bulimia nervosa. Remember that we can use fluoxetine along with CBT and nutritional rehabilitation in treating patients with bulimia nervosa. Now, with treating anorexia, we can utilize the second generation antipsychotic olanzapine. Remember, with second generation antipsychotics, the known side effect is going to be metabolic syndrome, which can cause weight gain. So remember the mnemonic O for obesity. So olanzapine can cause weight gain, and we can use that side effect in order to help patients with anorexia gain weight. Now, with binge eating disorders, we can use the amphetamine lisdexamfetamine, and we can also use SSRIs as well as cognitive behavioral therapy. Thank you for watching this video. Please like the video if you enjoyed it. I'll see you guys tomorrow.